assemble this. And there was another person, Kasia, who started with me 4 years ago. She was actually in Poland, but I want to say, I think 60% of the speakers tonight she sort of chased down and found, right? So I'm not going to do the individual intros right now, but I am happy to hand this off to Manish, who I was glad to meet probably now, what, 4 or 5 years ago?
Yes.
Something like that.
September
One of the first help
yeah.
to, wow, you actually remember the date.
Berlin it was.
So I saw this crazy guy, he saw this crazy guy, and we got bromance brewing. So I think Manish is a digital health futurist. I'll tell him, I'll let him kind of introduce himself. I'll switch to your slides, and jam-packed today. Yep, and there's the clicker.
I may need your help when it comes to playing the video.
No problem, I'm right here.
Okay, cool. So good evening, everyone. As Eugene said, I'm based in London. I used to work for the drugs company GSK, GlaxoSmithKline in R&D with big data, and then I left 4 years ago, and I've been immersing myself in this world of digital health, looking at all sorts of things, AI, virtual reality in the last year or so, artificial intelligence, and looking at the convergence of these technologies. And I want to talk this evening about immersive health. Are we ready? Now, I want to ask you, is there anybody in the room who's younger than 24? Okay, we have a few. I asked you that question because look at these two books. The one they're both one published in Germany, the other was published in the US. These were actually published in 1992, so 24 years ago, right? Look at the virtual reality won't merely replace TV; it will eat it alive, is what the book's cover says. On this one, again, revolution in technology that promises and threatens to transform business and society. So we were there 24 years ago. Virtual reality existed then. The technology existed then. People were hyping it, saying it's going to change lives, but it didn't, right? And we're at the same point again. So when it comes to augmented reality, the term augmented reality was actually coined at Boeing in the US, the airplane manufacturers, in 1990. So that's 26 years ago. So when we hear the tech media talk about augmented reality, virtual reality, as if they're brand new technology, they're not brand new. They have been around for a while. There's a lot of research out there already and a lot of evolution. But what's real today is the fact that it has become accessible to so many more people. So for example, this was on the 14th of April this actually happened. This is a chap in London, a surgeon called Shafi Ahmed. He live streamed using 360 cameras in his operating theatre in the hospital in London. And people with virtual reality headsets, even these €5 Google Cardboard headsets, and their smartphone could basically be there at this cancer surgery in London. And people anywhere in the world with those two items, smartphone, obviously internet connection, and that Google Cardboard device, or you could go with a higher end VR device. So that's what we can do today. That's what's happening within healthcare in terms of at the edge. Now, what is the reason for all of this interest now in 2016? Well, it's a convergence of technologies. Primarily, the biggest single driver of this is the fact that we now have smartphones with displays and GPUs inside, which are so powerful that before 20 years ago, these would have been big boxes, and now it's a smartphone. And the fact that these headsets like this have become so cheap. So if you want to consume content now, you just need your smartphone and this the £100 headset that Samsung are giving away for free. This is one by LG. This has just come out. This is a £200 headset, again, uses their new LG G5. Now, that's for consumption. The other thing that's coming for mass consumers, for everyone, is the fact that you don't need to go to an agency to create content. You can actually create VR content using these new 360 cameras which are hitting the market. Yes, they're relatively crude and clumsy, but it's the first time you can get something like this for a few €100 and create your own 360 videos. Facebook supports 360 videos. YouTube supports 360 videos now. So they see it as this next big publishing platform in terms of content. The other thing is there's now this chap called Chris Milk. He's received a lot of views for his TED talk, how virtuality can create the ultimate empathy machine. If you haven't seen his talk already, watch it. It's really good. But even better is he was commissioned by the UN, his agency, to create a movie, virtuality movie called Clouds Over Sidra. And it tells a story of a 12-year-old Syrian refugee in a refugee camp on the Jordanian border. And when you watch that 8-minute movie in virtuality, I wasn't expecting to be crying most of the way through. It's that immersive, it puts you in her shoes. So when it comes to generating empathy, when we think about healthcare, what could these ordinary headsets coming to the market now, how could, for example, we immerse a physician in the life of somebody with Alzheimer's who's living on their own in a village who's 80 years old on a low income, for example? How could we use these headsets to, if somebody's prescribed a medication and you want to convince them of the value of adhering to the treatment regime, you prescribe them a VR experience that shows the impact of that diabetes medication in their body, so they again see they generate empathy for themselves and they stick to the program. This young lady called Molly Watt, she's based in England. She's 21 years old. She's living with Usher syndrome. She's deaf and blind. But I met her recently, interviewed her, showed her the 360 camera. She went out and bought one, and she's going to explain now in the video the impact on her life. So when we talk about evidence and clinical outcomes and how is this impacting people, this new technology, here's one real-life example. It's a 2-minute video.
My name is Molly Watt and I have Usher syndrome. Usher syndrome is the most common form of deaf blindness. It starts off where you're just born deaf. I was born severely deaf. I was given my first pair of hearing aids at 18 months old. Once I got to adolescence, so I was 12, 13, when I started getting clumsy, experienced night blindness, and I could no longer lip read or read the board at school. Everyone just assumed I needed glasses. Turns out retinitis pigmentosa, which is actually a progressive form of blindness, and having retinitis pigmentosa and deafness put together is in fact a syndrome. So I have type 2, it comes in 3 types. I currently have 5 degrees vision in one eye, so within 2 years I've been sighted to severely sight impaired, which is politically correct for blind. How I access life is through technology. I do a lot of blogging on this as well. One of the things I was asked to talk about specifically in this video is the 360 camera. I use this, it amazed me really, the fact that you can, I use my iPhone for a lot of things when it comes to access. You know, it's my own little gadget in my pocket that I take with me everywhere. This camera can capture more than just a picture, it's more of an atmosphere. It's got all the peripherals in one screen that I can access to my phone. The reason why this is so huge for someone like me is the first thing I lost was my peripheral vision. So I have like 5 degrees vision in one eye, and I've got blind patches in the other eye. And so it's like looking through a straw, if you like, through one eye. First thing I lost were peripherals. So an image captured by this 360 camera captures all the peripherals and puts it into my one iPhone screen, which I scan around, I can zoom in. But it's the first time, if you like, in say 6-7 years since I was registered blind, I've actually been able to see peripherals, which is strange. It's a strange feeling. So with that bit of technology, it really encourages me to think what more could be done with something like this, and how this could actually give someone like me more access to the world and how we view things, how we see things, and most importantly, how we access everyday life.
So that was really moving for me. She's also blogged last year about she got her Apple Watch, how it changed her life, made her more independent. She was able to access things on her own using a watch and the certain features that Apple had developed in the watch. And her blog got so many hits, she ended up being invited to Apple headquarters in California. The leadership team took her around, talked to her, said, tell us how we should develop more technology that could be used for people like you and others around the world who have accessibility issues with other technology. So to think this is a 21-year-old girl in England, and just her use of tech and blogging and tweeting is basically sharing a message that actually this kind of ordinary tech can change lives. Now, this was in terms of, again, impact. So again, it's a 360 camera. By the way, this is currently recording my talk in 360, so I'll be publishing it on YouTube so people can look at it afterwards. But I was invited to a workshop on decision-making and cancer prevention by Cancer Research UK. It's a big charity in the UK. And they invited a whole bunch of people together, said they wanted risky, high-impact ideas that couldn't be funded through normal channels in terms of behavior change and preventing cancers, right, through changing your diet, stopping smoking, etc. I formed a team with a bunch of strangers I'd never met, and over the course of 3 days, we came up with an idea, and I was showing them the 360 camera, and it turns out that one of the problems with stop smoking programs is that actually when you enroll in the stop smoking program, when you go and see your doctor, and you're asked to record when you have your cravings to smoke, and so they can capture that information, you have to write a form, you have to fill in something like that. It's tedious, it's a burden. So I said, well, what if we can use a 360 camera, give it to these participants and stop smoking, and a picture tells 1,000 words. They just take a 360 selfie every time they have a craving for a cigarette. We use machine learning and AI in the cloud to analyze that 360 image from the camera, and we get that analysis in terms of the doctor knowing what are the triggers. So through the machine learning, you can pick out they were at McDonald's and it was raining, they were on their own, they were sad, for example. So you think about, again, the 360 camera, actually, if you go to the website, please, with the 360 image, so it turned out that they were funding some of the projects out of the ones that were pitched. It's a spherical image, that one there. And if you might have to reload it usually. So this is a 360 image because our team actually won funding for 1 year's research sponsored by Cancer Research UK to investigate the use of this camera. And so we had a researcher, a doctor on our team. So if you scroll around now, you can see that's one of the members of our winning team with his hands up, Richard. And so I took the 360 images again and tweeted it just to say that, you know, we won. But the point I'm trying to say here is that this is very humble, simple technology. It's not expensive, but it's about using our imagination to understand what value might it add in the healthcare system. And if I go back to the final slide, so I've bought a whole bunch of 360 cameras that are available to consumers that have just been launched. I've ordered this is me with the HTC Vive in London. I'm running workshops in London from June 2016, which will cover right through from what's the evidence of the use of VR so far, hands-on experience with all the different technologies, and actually my insights into actually how can you use these technologies that are here today in your organizations when you go back to work tomorrow. And then finally, I just want to conclude on making the point that I really believe that these technologies that are coming on the market now for consumers have the ability to change lives, just like we've seen with Molly. And it's a question of what do you want to do with that technology? What does this inspire you to do tomorrow when you go back to work? Thank you very much. And if you're interested, later on when the event finishes, I've got two of these, the Gear VR and the LG 360, so you can have a play with them after the event. Are there any questions? Have we got time? A few minutes?
We got time for some questions. So, anybody?
Nobody? Oh, we have one.
So, you might already have some results of your research on the 360 camera with the
Sorry, have I got any results already? Yeah. Well, we just won the award for funding a couple of weeks ago. The study will start in July and it'll be a 12-month study. But the point is, it's like a major funding body that has said, like, that's a really cool idea. Let's try it. You know. But if you want, we can stay in touch and I'll let you know how the study progresses.
What artificial intelligence do you use, or would you prefer?
So for the study, Google have just released something called Cloud Vision Beta. They launched it in February, so you just basically send your images and you pay per how much you use of their service in the cloud. So actually, and it comes back and it can do things like sentiment analysis. So it can actually come back and tell you whether the people in the picture are feeling sad, happy, angry. It can even tell you, again, product logo. So is there a McDonald's, is there an Albert Heijn in the photo, in the image? It can even detect, for example, if there's flowers, animals. Again, it's a beta, so it's not 100% accurate, but it's evolving over time. But the point is that you don't need a human being, a doctor, to sit there and say, I think you started smoking because there's a McDonald's in the background and it was raining, right? So that new service will allow you to get that, to analyze that image effectively.
So the next speaker trying to pull in, but we got time. Camille, just hang tight, please. We're finishing up, so I'll put you on mute. Okay?
Okay, great.
And if you can mute yourself as well. Thank you. You can listen in to us, but please mute yourself.
Okay, I'm forward. Okay.
There were another couple of questions. Are you happy with the answer?
Yeah.
Congratulations, nice to listen to your story again.
Thank you.
I'm really curious, what would be the expectations of the people that fund you right now, the whole project? Did they make anything explicit about
So
what
that innovation workshop was separate from their normal funding, and they were looking for ideas that were unlikely to work, as in very high risk but potentially high impact. Small pilot funding for 1 year to just see, could this potentially work? And if at the end of the year it works, it could be research that gets scaled nationally or internationally. Was there another question? Can you, yeah. No, so at the moment I'm not, but I mean that's a very good point that again, before people in healthcare are going to say, let's invest 3,000 euros on a bunch of 10 360 cameras, you're going to need, because these are so new, there hasn't been enough time for researchers and scientists to say, you know, can this actually make any difference? You know, so again, if we have a choice in healthcare and social care, you know, with limited funding and funding going down and demand going up, you know, we've got 3,000 euros today to spend in our organisation. Do we spend it on 360 cameras and VR, or do we spend it on trying to get some part-time person, for example, to help out, right? So, you know, we have to bear that in mind. That does this technology is sexy and cool at the moment. Potentially it can do so much, but we have to balance it with actually what are the other needs that we need.
One more question?
Like thought of any other topics to research using the camera. Right. So now you mentioned cancer and you gave the example of the girl being assisted. I'm sure you thought of some other diseases topics.
Well, I think in terms of, again, the main advantage of the 360 camera in terms of content creation is people sharing, immersing you in their environment. So again, it's about, for example, if you are a doctor or a nurse or a healthcare worker, you're trying to understand what is the state of people in their own homes. They're living on their own, for example, they're getting older on their own. How are they coping? Maybe you want a 360 selfie, or you want a 360 video. So you give them the camera, you tell them to switch it on, and you want to see them moving around in their own environment, and you want to look for those signals there through a video that you can just see on YouTube. Anything else?
Manish, since he's staying in Amsterdam, he'll definitely be hanging out afterwards because I'm his hotel tonight. So, thank you, Manish.
Thank
that
you.
was awesome.